Hello, everyone. Welcome to our last edition of Wellness Wednesdays with the American Cancer Society and Tampa General Hospital. Over the last 3 weeks, we've had a great conversation with Dr. Lacey Clement from Tampa General on mental health, and particularly its impact on those dealing with cancer and those caring for folks with cancer. Last week, there was a discussion on healthy summer activities, and today we're going to tackle lung cancer screening. My name is Dan Johnson. I'm a proud volunteer for the American Cancer Society and sit on the area board. I want to share my sincere appreciation for Tampa General Hospital and their efforts to help keep our community well. It's been my pleasure to discuss these topics with the experts from Tampa General. Today's topic has significant relevance. Coming out of the pandemic, we've heard a lot of discussion about screening in particular, and cancer screening even more important, and the challenges that the lack of screening because of lack of access to doctor visits has created. But I have to admit that when I think about cancer screening, I typically think about colonoscopies and mammograms, things like that. Lung cancer doesn't always pop into my mind. But the statistics tell us that we really should think about it. Lung cancer, when you combine both small cell and non-small cell, is the second most common cancer in both men and women. And even more challenging is that it's by far the leading cause of cancer death among both groups, making up almost 25% of all cancer deaths. So our conversation today is going to focus on what you need to know about lung cancer screening. We'll probably go about 15 minutes. And at the end of the conversation, there may be time to ask some questions. I'm thrilled to be joined today by Dr. Sommers, who's a nationally renowned thoracic surgeon with Tampa General, who's performed more than 6,300 cardiothoracic surgeries, with almost 3/4 of them being for lung cancer. So Dr. Sommers, welcome, and please introduce yourself to our audience.
Well, thank you very much, Dan. It's a real pleasure to be here and share information about lung cancer screening. I am the Director of Thoracic Surgery at Tampa General Hospital, and I also direct the Thoracic Oncology Program, which includes lung cancer and lung cancer screening. And I have over 25 years of experience caring for lung cancer patients and performing resections for lung cancers. It's a real pleasure to be here and to hopefully raise awareness about what can be done to prevent lung cancer and deaths from lung cancer through screening.
Well, thanks again. And I know the information you have to share today is going to be of great importance to the folks listening in. So the first question that I have for you is really a two-part question. Clearly, it's the lung cancer screenings are important. Why is that? And really, who does it impact?
So as we all know, lung cancer is predominantly a disease of smoking. And we've really been hobbled, as you've already mentioned, in lung cancer in comparison to the other cancers. We haven't really previously had a good way to identify lung cancer in the early stages when it can be cured. You mentioned colonoscopy for colon cancer, and obviously everyone knows about mammography for breast cancer. But it really has been more recent that we've had a technique that can find lung cancer in its earliest stage when it's most curable. That technique is low-dose CT scanning. These days, everybody knows what a CT scan is. You basically get sent through a big old donut, and that donut takes an X-ray picture, and it can show us the anatomy in great detail. And we can take advantage of that technology in appropriately selected patients to actually look for these cancers before they become symptomatic or give rise to symptoms like a cough or chest pain. And the reason that's important is that most lung cancers are found when they're actually in the late stages, when they're giving these or cause these kinds of symptoms. It's actually, in most cases, too late to operate. So that's why it's so very, very important that we find these cancers when they're early and they can be removed and therefore cured. And the technique of low-dose CT scanning allows us to do that. So the next question is who is best served by this type of screening? And no surprise, it's people who have a history of smoking. And they have recently expanded the population of those people who would be eligible for lung cancer screening to broaden the availability of screening. Very briefly, it's available to those who are 50 to 80 years old. You have to have a smoking history, a pretty heavy smoking history, and the way we tally that up or count it is to take the number of packs of cigarettes the person has smoked over how many years. So let's just say, for instance, you have a history of smoking a pack of cigarettes a day, and you did that for 20 years, your smoking history then would be 20 pack years. So you just multiply the number of packs of cigarettes times the number of years smoked, and then you have a pack year smoking history. So at this point, those people who have a history of 20 pack years, so one pack of cigarettes for 20 years or 2 packs times 10 years would add up to the same number. That's 20 pack years. And if you are a current smoker or had quit within the last 15 years. So those are the criterion, the current criterion for lung cancer screening. So between the ages of 50 and 80, a 20 pack year smoking history, and either currently smoking or quit within the last 15 years. And that would qualify you for free lung cancer screening paid for by either Medicare or private insurance company.
So it's great to know who should be screened, but I guess there's a step before that. An individual has to go see their doctor ahead of that to get things scheduled. When is the right time to go see your doctor, and what types of questions or things should you be discussing with your doctor if you're either in that group or maybe just below that group?
So it's always important to remember the best source of information for your health is always your healthcare provider. It's important to discuss your concerns, particularly if you're a smoker, and they can help you decide whether you qualify for lung cancer screening or if it's right for you. So that's the first thing to keep in mind is this is an important question to share with your healthcare provider and get their opinion, and also to help you make the determination whether you qualify for screening. So that's always the first place to start. We have resources available at the hospital, of course, specifically for those who are logged in. Jenny Martinez is our lung cancer screening coordinator, and you can contact her at 813-844-4278. I'll give that number later on. And any of the tower radiology facilities can also assist you in getting in lung cancer screening, or of course, making a initial decision whether it's right for you.
So take us through the how of the screening. So if I think back to, it's unfortunate, but a lot of my medical knowledge comes from a TV show, which means I have virtually none. And I remember the thing that people get on and slide into this tube where it seems sort of claustrophobic. The way you described it earlier of a donut, it doesn't sound very claustrophobic to me. Let's talk a little bit about the reality of the screening versus what folks like me may have seen on TV.
Right, so it's a very simple process. It is a CT scan. These days, we have scanners now that can do the whole thing in literally a matter of seconds. So you would be placed on a table, and you're basically slid back and forth through the we call it the gantry or the donut, and that process really doesn't take very long, and can generate really an amazingly accurate picture of your lungs and whether or not there's anything to be concerned about. So that's the actual test itself is really, really nothing to be concerned about or anxious about. Occasionally, somebody does have claustrophobia, so that can be a concern to certain patients. But by and large, the test is pretty straightforward. Like any test, it can have positive results that are not related to lung cancer, and so of course that'd be something to discuss further with your doctor. And it's important that when you obtain or get lung cancer screening, you get it at a place that can handle, of course, the potential that there may be a positive finding. That's what we're looking for. We're looking for people that have early stage lung cancer, and of course, those resources are available at Tampa General and throughout the Tampa General system. So those are the that's the basic mechanism for how lung cancer screening actually happens.
Great. And just a quick reminder to our audience that if you do have questions, please feel free to type them in. Dr. Sommers, a lot of people think about going for screening, but then think, gosh, I don't know if I want to, I'm worried about it. I may have bad news. You just mentioned about talking to your physician because it certainly gives you, if you have the results, it gives you the opportunity to figure out next steps. How do you sort of alleviate that concern that folks may have of, I don't know if I want to know what bad news is coming?
Right. So, it's always a little scary to consider the possibility of a positive result. But keep in mind that the benefit is that you have an opportunity for cure that you may not have had before. So those who have lung cancers that are discovered by screening have a much better prognosis or outlook than those that forego the screening and the cancer pops up later at a later stage, of course, with a smaller chance of cure. So I think that's the most important thing to keep in mind is what a great benefit that the screening can have if you're a smoker in finding or detecting a lung cancer that would otherwise might several years from now present with a way worse prognosis. And it's important to keep in mind that lung cancer screening should be annual. It should not be a one-time thing. If you meet the criterion, your risk of lung cancer doesn't go away because you've had a negative screen. So you have to commit to an annual or yearly screening so that should a lung cancer pop up at some point, you can still find it and have it taken care of and vastly increase your risk of cure from that cancer.
Yeah, that's interesting. I hadn't thought about it being an annual type of thing, but glad to know that that's the right frequency to get the screening. So we just have a couple of minutes left here. You and I had a chance to talk briefly before coming on the air about some of the other things that are going on today in terms of vaping and cigar smoking, and people generally think about cigarettes and the potential negative impact. What in the kind of early stages of vaping, the last 5-10 years or so, any thoughts on vaping and the potential health impacts?
Well, sure. First of all, I don't think of vaping as safe. I think that we don't know what the long-term impact of vaping is on people's respiratory function or health in general. We do know that there are adulterated materials being vaped that have led to death in young people. So it's not without risk. There's sort of an attitude that vaping is a good alternative to smoking, and I'm not sure that any activity that involves repetitive use of addictive substance like nicotine is a good thing at all. I would say that if it were used in conjunction with a quitting program, perhaps under the guidance and advice of a physician, then that I would certainly say if that helps someone quit cigarette smoking, then I wouldn't argue with that. But I think the widespread use of vaping, particularly in younger people, of high doses of nicotine, it can't necessarily be called a good thing or something that we should be encouraging. So But I would say, by and large, we don't know the long-term effects of vaping. I discourage young people to start vaping, and if they are vaping, to try to alter their behavior simply because we don't know what the long-term effects are.
Well, great advice there. And Dr. Sommers, thanks so much for your time today and your insight on lung cancer screenings. And I'd like to just say thank you to everyone in our audience for tuning in today to our Wellness Wednesday with the American Cancer Society and Tampa General Hospital. If you need any additional information on lung cancer screening, please use cancer.org or the number that Dr. Sommers mentioned earlier. In the description of the event, you'll find several helpful links regarding lung cancer. And don't forget to schedule your screenings and take care of yourself. Have a great rest of your day.